So welcome everybody. I am Kevin Ressler. I'm President CEO here at United Way of Lancaster County. And I am grateful to be joined by a variety of panelists here who I have been able to mostly interact with or work with in different ways. And I've been grateful for all of the different work and conversations around issues around food that I've been able to participate since the beginning of the pandemic. There's been a lot of changes in this sector, both from a needs perspective, but also from how the system allows us to respond, different levels of support, different ways in which people are able to even receive those products that you used to have to pick them up, and now they can be delivered to you. All kinds of things that have changed, and so we welcome those of you here who are interested in this conversation, just because you're a community member, or those of you who are interested in this conversation because you join in the work, either as a paid staff person or as a volunteer. The reality is that food is one of the most significantly important things that happens, right? That you've got air first, water second, and food is third. Of course, shelter, another conversation we also have frequently, it connects with that. But even to have shelter and to have no food, obviously, you don't last very long. And so it's really important that we have these conversations continuously. And as we know, numbers around homelessness are increasing, which becomes a significant issue there at United Way and YWCA, Chamber, Community Foundation, others have put out a racial equity report. We know that there are different elements to food access that impact different communities around poverty, around race, all these different elements. So we're going to talk about that a little bit today. And I'm going to assume that everyone's now filtered in. So we're going to get this started here. I will be the moderator for the panel conversation later. If you've not participated in one of these before, the way our community conversations go, we will have a presentation, and then we will have a good dialogue and conversation. We hope that you'll put questions and Q&As in those chat buttons down there at the bottom of your Zoom screen, and we'll try to work those in. We do hope that this is a conversation. But let me just go through here. Who are we hanging out with today? So let's start with Mary Beth Williams. Please go ahead and introduce yourself.
Hello, I'm Mary Beth Williams, and I'm the Vice President of Student Affairs at Millersville University. I've been here since last July, so I'm relatively new to the Lancaster area, but I've been working in higher education, specifically interested in food insecurity and first-generation college programs on college campuses for over 24 years. It's an honor to be here.
Thank you. Thank you for joining us. Brad, let's hop over to you.
Hi, good morning, everyone. Brad Peterson. I'm the Executive Director of Power Packs Project. I've been here for about 3 years. Power Packs has been around for about 18, well known in the area, and very happy to be joining this team here. Great team doing great work in the community.
Thank you, Brad. Sandra?
Good morning. I'm Sandra Valdez, Chief Operating Officer here at SACA, the Spanish American Civic Association. And I've been with the organization for almost 24 years in different capacity, and definitely in regards to a community meals program that we host in our city for those in need. And I'm very happy to be part of this panel.
Thank you so much. And Zach, we'll go to you next.
Morning, everyone. My name is Zach Zook. I'm the Senior Policy Research Manager at the Central Pennsylvania Food Bank. Our team at the food bank, which is the Feeding America member food bank that represents Lancaster County and 26 other counties in Pennsylvania, is responsible for building our research and data infrastructure. And we're also running a Lancaster County hunger mapping project this year. So lots of exciting stuff to share over the coming months, and excited to be with you all today.
Excellent. And that leaves us with our panelists. So the rest of us will drop off here, and we'll pass it over to Phil if you want to introduce yourself and take over. Thank you.
Thanks, Kevin. And I am Phil Falvo. I'm the Public Policy Director here at United Way of Pennsylvania, and I am going to be talking to you this morning about ALICE. ALICE stands for Asset Limited Income Constrained Employed, and here in Pennsylvania, that is about 27% of Pennsylvania households. When we talk about ALICE here at the United Way of Pennsylvania, we are not talking about those living in poverty. We are talking about people who are working and struggling to make ends meet. So when we talk about ALICE, we talk about certain terms, one of those being the threshold or the ALICE threshold. So that is the level at which people are living and trying to survive. That term does not mean that people are making it. They are struggling to make those ends meet. There is no room in that budget for any type of savings or any type of extras. There is no going out to eat. There is no ability to take a vacation. And these households are literally one financial disaster away from total catastrophe. United Way has one specific goal to get folks that are in this criteria, in this category, to sustainability. And it's not easy. I mean, this is a large category here in Pennsylvania. People living below the ALICE threshold is 40%, or 2 out of 5 households. It's friends, neighbors, colleagues, people you pass on the street who are living paycheck to paycheck and unable to afford the basic essentials. So as I mentioned, ALICE is 27% of households. When you combine that with the 12% of folks living in poverty, it's 2 out of 5 households in Pennsylvania. It's quite a large number when you think about people here in the Commonwealth. As we know, ALICE knows no boundaries, as does poverty. It hits every age bracket, it hits every household composition, it hits every demographic we could possibly think of. For Pennsylvania household breakdowns, we see a large segment of ALICE is actually single female-headed households with children. That is the largest demographic across the Commonwealth of Pennsylvania. After that, it actually happens to be married couples with 2 children in childcare. On May 2nd, United Way of Pennsylvania will be refreshing the data with new data that explains the impact of the pandemic on ALICE households. You're going to see, and I'm not supposed to say this, but I'm going to tell you out loud, that not much has changed for ALICE households. The struggle is real. If it wasn't for pandemic assistance, ALICE households would not have made it through the pandemic. When we talk about ALICE households, the thing we talk about the most is the survival budget. So the survival budget is calculated based on household essentials. So the cost of housing, childcare, food, transportation, healthcare, technology, and then it considers taxes and miscellaneous contingency fund of about 10%. That's for household emergencies. That is not for any kind of extras, so to speak. The thing it does not take into consideration are cable service or any kind of additional amenities, such as household gifts, extravagant dinners, and such. One thing you'll notice on there is there's a senior survival budget that was new in the last report that will actually be enhanced in the next one. It adjusts the household survival budget to reflect the fact that seniors have lower food costs than younger adults. They travel less and they have fewer family responsibilities. At the same time, they have higher out-of-pocket medical needs and greater expenses for personal care items. So the household stability budget, which is something else we talk about, that is all of the ALICE budget categories plus 10%. So that's an additional 10% for those little bit of extras. That's our goal here at United Way, is to get people to sustainability. You'll note that in the chart on the right, there's a comparison between the federal poverty level and the survival budgets. The problem with the federal poverty level is the calculation itself. Federal poverty level is calculated based on consumer price index. That takes into consideration a wide variety of consumer goods that ALICE is not purchasing. The ALICE Essentials Index, as I mentioned, is taking into consideration the basic essentials for a household. So when you look at the ALICE Essentials Index compared to the Consumer Price Index, the chart on the right, you see a stark deviation between the two. That's because Consumer Price Index looks at a variety of consumer products. So for federal poverty level, you see these lower numbers of actual costs for individuals, where with the survival budget, you see it at a much higher actual cost because it takes into consideration things like the cost of housing. The other thing to take into consideration is that CPI only tracks inflation based numbers in metropolitan areas. The Alice Essential Index looks at rural, urban, and suburban areas. This chart is a breakdown across the Commonwealth of Pennsylvania for each of the budgets compared to the federal poverty level. The thing I'll note, since the topic of conversation is food, for a family of 4, an annual monthly budget of $839 for food. These are older numbers. These are about 2018 numbers. Our newest index will be 2021. The thing I will point is this is based on the Thrifty Food budget. $839 for a family of 4 with 2 children at today's costs, not a chance. That's what, $209 a week for food. Factor in your laundry detergent and everything else at the grocery store. I got very high costs. So the stability budgets, as you see, are much higher, but still not very realistic. Housing is a number we always point to. The cost of housing itself here in Pennsylvania is higher. We see that there's a lack of an affordable housing stock, which became very evident during the pandemic. Again, the food line items in the stability budget are up. They're considerably higher compared to what they were in the survival budget. But again, for a family of 4, 2 adults, 2 children in childcare, 1807, much better, but still questionable at times for food, depending on the needs. If there's special dietary needs, if there's a child with something like celiac disease, you're talking very specialized and very expensive foods. Again, housing, very, very, very conservative estimate. So in getting into Lancaster County, I pulled some data together to take a quick look at what Alice looks like in Lancaster County. So as I mentioned, it's Alice is 27% here in the Commonwealth of Pennsylvania, and Lancaster County is just about on par at 26. But the poverty picture in Lancaster County is significantly better. It's a little bit more than 2/3 of what it would be here in Pennsylvania. So we're 12% in PA, 8% in Lancaster County. Median income household, the statewide average in 2018 was about 60,000 for Lancaster County, 66.2. Households above the Alice threshold, 133,000, fantastic. Lancaster County is clearly doing well compared to some parts of the state. If you go out to our United for Alice website, unitedforalice.org, if you go to the state websites, you can look at Pennsylvania and you can compare each county. You can also go to our UWP.org website, to our advocacy site, and click on Alice and see the map and compare each county, and you'll see how well Lancaster County is doing compared to other counties. I took a quick breakdown of the racial demographics in Lancaster County. No surprise, minorities aren't doing as well in terms of poverty and Alice categories compared to those of white households. When we compare to the rest of the Commonwealth, we see that some minority communities are doing a little better in terms of poverty, but not as well in terms of Alice. That's actually a good thing. That means that our communities are supporting minority households. In terms of the survival budgets versus the federal poverty in Lancaster, we see housing, again, a really conservative measure. Food, for a family of 4, we are looking at $1,218, I believe. Yes, $1,218 for a family of 4. Conservative measure, again, $306 a week. This is a 2018 number. If I calculated the inflation out to now, I think that works to about $380-ish, give or take. As you can see, these are very conservative measures, and that's the interesting thing about the Alice budgets. They are very conservative measures. So in terms of economic stability, the real costs of what it would be to survive in Lancaster County, we tend to get pushback on these kind of numbers no matter which county we're talking about or which community. But these are also, again, based on actual living expenses. These are based on your typical household expenses without extravagance. Housing cost, again, $1,226. If you could find me rent for a family of 4 at $1,226, let me know. I'm happy to move because I am in Cumberland County and it's nowhere near that. The food line, $1,846 for 2 adults and 2 in childcare. Again, more realistic, but again, for parents with children or for adults themselves with specific food needs, that could be a little low. So one good measure we really have to measure need across the Commonwealth is 211, which is a partner of United Way of Pennsylvania. We help operate and fund 211 along with our local United Ways. This chart actually is from the Alice report. It's a great chart because it actually explains what would happen if we were to address the needs of Alice. I love that when you take into consideration that Alice in 2018, everybody living below that threshold was contributing to this economy. When you talk about Alice households and folks in poverty, there's this thought that they're a drain on the system, and that is not the case, especially Alice households who are working. So in 2018, they contribute about 43 billion in earnings to our economy, 1.6 in tax revenue, and community spending was about 44.4 billion, which helped in poverty alleviation. If we were to take everybody living below the Alice threshold and take them to sustainability, it would generate $130.2 billion per year in GDP for the state of Pennsylvania. And to give you an idea, our state budget is $45 billion annually. At least that's what it was this year. So that's over 3 times just about 3 times of the Commonwealth budget. That would address a lot of issues here in Pennsylvania. But again, it costs money to make money and save money. When we talk about Alice, we talk about barriers. We talk about those things that are preventing folks to get from survivability to sustainability. These are the top categories we see in the report. We talk about transportation as a barrier. Without transportation, households can't get to work. The one I like to highlight a lot is childcare. That's a huge issue across the country, especially here in Pennsylvania. Childcare facilities are closing classrooms as well as entire facilities because they cannot afford to stay open. The rate that the state pays childcare facilities for families in childcare works is 60% of what the actual commercial market rate is. It's much lower. Some facilities are being forced to operate at a loss. You have lack of access to affordable housing, the opportunity to access educational and career advancement, and financial literacy programs. For folks who are trying to get to that next level, they need access to all of these things. Food is also equally important. You heard Kevin say it earlier. The most important needs: air, water, food. And I apologize if I'm going quickly, but I'm on the clock for 15 minutes. So I promise I will make this presentation available to everybody who's watching through the United Way of Lancaster. So when a person calls 211 with a need, or if they text 898-211, or if they are on the website doing clicks and looking for information, we do not require submission of demographic data, income data, or any other kind of personal identifying information. We want to know where they're located. Submissions are voluntary. Any individual that is in crisis can contact 211. There is no income criteria for that. So why is that important? Because we get an actual idea of where the need is at, not just based on income. It's across the board. So in 2022, Pennsylvania 211 received over 928,000 calls, texts, and clicks. Okay, just calls and text alone accounted for 325,790. So it was up 7% over the previous year. During the pandemic, we received over 1 million calls, texts, and clicks. In one calendar year, we were at 928,000. There's a clear apparent need across Pennsylvania for support, despite being supposedly outside the pandemic. Households are struggling, we see it. One thing I decided to take a look at for this specific discussion is food requests and requests for food assistance. So in calendar year 2022, 211 received a total of 18,000 requests. The top 4 categories were food pantries, requests for help with buying food, holiday meals, and soup kitchens. Requests for information on soup kitchens and meals to go. The interesting thing that I found was in Lancaster County, the highest number of requests for help was with help with holiday meals, whereas in the Commonwealth, it was location of food pantries across the Commonwealth. You see a little bit of similarity in other categories, but that holiday meals really stood out to me, knowing that there's a larger religious community in Lancaster County. That did not surprise me. So with that, Invite all my friends and colleagues here to come back to the table and let's talk about some of this data and some of the issues around food insecurity here in Pennsylvania, especially Lancaster County.
Thank you, Phil.
welcome.
Those are not comfortable numbers in a lot of ways. This is our community, and this is who we are. I want to just real quickly open with, so for those of you who don't know how the poverty threshold was created, Molly Orshansky created this threshold from some research she did in 1963 to 1964 and released a report in 1965. That is how our poverty thresholds today are still calculated. The data that she used, the sort of formula, was that 1/3 of your household incomes would be food, and then the rest of your sort of, sorry, one third of your household expenditure would be food. The rest of your household expenditure was everything else. 1965. She got the data on the 1/3 number because in 1955, a survey on food usage indicated that people were spending about 1/3 of their income on food. Now, 1955 is very different from 2023. I mean, even if we just want to go as simple as internet is at this point a basic necessity for survival in this economy, whether that's from purchasing things or applying to jobs. Internet is not cheap, and particularly for individuals who are on the lower income scale. That's just one example of something that's not even accounted for when we use those poverty thresholds. So that's the importance of using this ALICE data, is it's taking a more modern approach to what it actually requires to survive. So just wanted to give that sort of context. And from there, I actually want to go to you first, Zach. If you could talk about this hunger mapping. Phil just talked about 2-on-1 data, and we're not asking about, or we're not seeing in Lancaster people asking as much about locations of food pantries and those things. Can you talk about the hunger mapping project you're doing and how that's going to help us understand maybe some of the reasons why people don't need to ask as much, maybe they already know, or where things are? So Zach, please.
Yeah, absolutely. So over the last year, our organization, together with Hunger Free Lancaster County, which is the collaborative network of charitable food organizations and other interested organizations in Lancaster County working to reduce food insecurity, has undertaken what we're calling a Lancaster County Hunger Mapping Project. We've been taking a deep dive into where access exists to food pantries across Lancaster County. Both looking at geography, but also looking at hours of access, financial requirements, other potential barriers to accessing food pantries, with the goal of identifying localized at the census tract, at the zip code level, food distribution and food access gaps, and with the goal of making food pantries some of the most easily accessible places that people can visit and potentially receive other services as well. So in that regard, we've also been looking at potential intersecting and upstream issues from food insecurity. So we've identified many of the issues that Phil talked about as kind of barriers to achieving food security in Lancaster County. That includes access to financial services, housing and affordability, evictions, all kinds of things that impact people's food security status. So our goal is to work to address that. One of the reasons I think food insecurity and the measures of food insecurity are so incredibly important is because it doesn't rely on some kind of like archaic formula to calculate food insecurity rates. We ask people directly a series of questions, and the USDA does this as well, about their food security status. So we can compare food security status over time. And unfortunately, nationally, but also in Lancaster County, we've seen a stagnation of food security around 9% in Lancaster County, around 10, 11% nationally. And we've been unable to kind of reduce food insecurity beyond that point. So we're trying to think creatively about how we as a charitable food system, but also as a society, can work to reduce food security or to reduce food insecurity in the long term. Yeah, Kevin, the other point you wanted me to address, could you ask that again?
Well,
Yeah.
actually, that was great. And I want to use that to slide over to Sandra. So, Zach's talking about sort of like where you can go, and SACA has a couple of different places that provide food, people come to receive food. Can you start there? Sort of what does this look like from a social services agency? You, maybe even some others that you know about, but starting with SACA for sure.
Absolutely. Yeah, I think it's important to note that even though there is access in the county through either warm meals or meals to go, or even through the food pantries, not everyone necessarily has the access. And again, come back to Phil, to transportation can be a barrier for many individuals to access, especially if they have numerous of little kids and children, that it makes it even more difficult for them. But through SACA, we're able to provide community meals 6 days a week, meaning dine in person. We no longer doing the grab and go. So the individual can come in between 12 and 1 Monday through Saturday and be able to obtain a hot meal while they're there. And our offices are also open Monday through Friday to be able to have access to wraparound services. So whether it's human services, whether it's linkage to housing, homelessness, whether it's mental health, behavioral health, or drug and alcohol. So we do at the organization have a wraparound services that we are able to offer to any participant who comes through our program. And additionally, now we have the evening meals. Now, one meal, it's surprising if those individuals who are in need even obtain one hot meal, let alone 2 hot meals per day. So we're able to offer that as well, Monday through Friday, a hot meal between 4 and 5 p.m. for individuals to also have a dinner, access to a warm meal in the evenings. And then as well, we still have the staff around to be able to provide those services, wraparound services that person may need. But we do try to help the Saturdays by having volunteers from different churches, faith-based communities, from different organizations to come in and volunteer. We have an individual, whether it's a manager or a staff from SACA, who's also participants on a Saturday, that is able to at least provide that referral, because even though we're providing the services, we know that not all agencies are operating on a weekend. So it's very difficult to link someone to a particular social service organization when they are not necessarily open on the weekend. But we try to make sure as best as possible so that we can A, refer them, B, meet their needs internally, or C, ensure that we're also following up with them on a Monday to ensure that they are actually being able to receive or have access to those services that was being referred to. Right now we have a great partnership with United Way, where we actually have a case manager in-house who's providing direct service to these individuals, not only to access for food, but all the other items that Zach and Phil have mentioned, housing, transportation, childcare. All these are essential needs for all of our clients that we're serving to ensure that they're able to move their family forward.
Yeah, thank you. And thank you, SACA, for partnering with us in that 2-on-1 shared relationship and exploring what it looks like to not just have to have that phone call, but be able to walk in and have someone right there with that database access. Now, we've talked a little bit about people having to go to food and the limitations and challenges of transportation. Brad, you sort of straddle this space of it's not quite going to food in the same way as a pantry. It's not always sort of home delivery like my old house at Meals on Wheels. You're in this interesting in-between space. Can you help people understand what PowerPacks does and even how it's maybe to some degree, how its own thinking has changed through the pandemic or even its own history?
Sure, Kevin. I mean, and really for us, everything has changed since the pandemic. So we'll talk about that a little bit. But, since our inception, our is to address the meal gap for children on the weekends when they don't have school meals. So to do that, we meet the families where they are, which is in the schools. So what PowerPacks does is every week during the school year and during our summer program, which is 8 or 9 weeks, we deliver a weekly pack to the schools for the families who are enrolled in our program. That's 90 schools, 15 different school districts in Lancaster, Lebanon, and actually now York County. We just started one school district in York County about a month ago, Eastern York School District. What those families receive each week is they get pantry items, they get peanut butter, they get cereal, they get canned goods, things like that. But they also get a weekly recipe, which is really what separates us, makes us very unique in what we do from other school pantry programs. Families get a recipe and all the ingredients for that recipe. So the recipe this week that is going out the door tomorrow and Thursday is a creamy chicken casserole. So they'll be getting chicken and breadcrumbs and some cream of chicken soup and elbow pasta to make that recipe. And then, we really are pushing something nutritious for those families. And we also want to make sure that they know they can create this nutritious meal on a budget. We put the cost of those ingredients on the recipe that we provide to them, as well as some nutrition education on food storage, food prep, all those kinds of things that can help them as well. We try to keep the cost of those ingredients to about $8 or less. This year, it's been $10 or more a couple times, just because we all know what food prices are like. And there's always fresh produce and always fresh milk as well. So, we don't do a home delivery like Kevin's, like Meals on Wheels does, or like some other programs. I know that the Food Bank Senior Program is partnering with DoorDash to do home deliveries. So we're kind of doing the next best thing for us. We're dealing with about 1,300 families a week right now. We don't have the bandwidth to be able to do that. But what we do is we incorporate all of our volunteers to deliver the food that we are distributing out to the schools, and some alternate sites that we have as well. Because, as Phil's talking about the ALICE population, these are working families. A lot of what we see are working families, and a lot of the schools, the families have to pick up by 3:30 or 4 if the kids can't take it home. So we're working with some churches, Lancaster Rec Commission here in the city, other places that can give some additional hours so families can come later than those hours and pick up what we're doing. So really, we try to incorporate what we can do to get the families the food they need to fill that meal gap over the weekend. And, as everyone knows, those numbers are going up and up and up. We're all seeing it. Our numbers are about 25% higher this year than they were last year. So we're really working as hard as we can to make sure that families are getting that food every week when they need it.
Yeah, thanks for that, Brad. I just want to point out what I love about Power Packs from a personal experience. My kids go to King Elementary, right? It's like the poorest census tract in the county. I get a message through the class dojo. It's Power Packs time. You sign up and pick up, and it is so valuable, as you said, right? When for organizations who deliver, someone has to be there, right? For organizations that you have to come pick it up, someone has to come pick it up. The kids are in school. The parents are coming to pick it up, or their family friend or whatever. But it is challenging even at that elementary school level, because kids are often walking home by themselves. Can they carry that in the backpack? So those partnerships that you're developing are fantastic. And you talked about schools, Mary Beth. I'm confused. I have a college degree. When you go to college, doesn't everybody have a meal plan? Why would there be any food insecurity on a college campus? That doesn't make sense. Help me understand what that experience is like for a college student. Why would they be food insecure? How is this, not working at the college space?
No, that's a really good question. And I think it's something that is really looked at as, wait a minute, people in college, you have to recognize that only about 32% of our students live on campus. So the other 68% are in the Lancaster County community. And even those who live on campus, over half of our students are on Pell. And so that means that many of them, their estimated family contribution is 0. And the other piece to that is, where do they go when the residence halls are closed and they don't have the places to eat? I often say that the hungriest place on a college campus is Thanksgiving. And that's because our spaces are closed. But one thing that is particularly interesting about higher education, if you're looking at a public institution like Millersville, is our average student age is 27. Our average student lives in the community and works in the community. It's not the 18 to 22-year-old living the dream fraternity sorority member that you might think is living in the residence hall. Our average student is out in the community and working, and possibly a parent or a single parent. Where the average food insecurity population in Lancaster is between 9 and 10. Here at Millersville, our average for students who say, according to the same calculations that everyone else uses with the USDA, 36.5% of our students note that they are food insecure. And many of them will say, do I buy books? Do I buy food for my family? And they're trying to decide these things. And so we have been awarded the PA Hunger-Free Campus designation because of the work that we are doing. And that started right when I got here last fall, and we were the recipients of a PA Hunger-Free Campus grant. And that's because we work specifically with a 501c3 organization called The Hub, and they work with the Central PA Food Bank and local farmers to get food for our students. And all of our students can go there and get a hot meal 4 days a week, and they have a campus cupboard that is open 7 days a week. And so we really have to rely on that organization to help us. And so we've got that grant specifically so we can expand their opportunities. So it is really strange to think about our college students being hungry, but they're having to make choices between what they want to do. They could be working, but what they're wanting to do is further their education, hoping for that growth mindset of being here and struggling while they are hoping to get that degree later. And so in a way to help them not have to make those choices, we collaborate with the Hub here and have had a really solid relationship. I think we're kind of a model for what I would hope other institutions would do. We get calls from other institutions on a regular basis because of what we are doing to collaborate and feed our students outside of the meal plan, and keeping in mind that most of them aren't on the meal plan.
Right. Thank you. And you know, that whole sort of space, I think we often do think, like you said, it's just young kids living a dream. And we're not thinking about the fact that there's a lot of Alice population on that campus who are working. You know, we at United Way, we take our VITA program there. Some of the students learn how to be tax preparers. You know, there's about 7,500 individuals. We ran an estimate. It's about 7,500 individuals we estimate on Millersville's campus from staff and students who would qualify for the free VITA tax program, right? So that's a low to moderate program that provides free tax services. We're just wrapping up here today. I need to hit submit on mine. I'll do that later. But you know, there's a good question here, and anyone can hop in on this one, but maybe you, Zach, in particular, I think might be helpful, is around the change in demand on SNAP benefits, right? Because the SNAP benefits have decreased, and other things too. Like, so what's the pandemic's impact? Like Phil had mentioned earlier, like without some of this pandemic support, Alice families wouldn't have made it through. Not just Alice families, right? 40% of children dropped out of poverty overnight with the child tax credit, and then overnight they decided to stop extending that, and they immediately all went right back into poverty. So Zach, SNAP or other things, how has this impacted this sector?
Yeah, absolutely. So the pandemic assistance programs we saw have a dramatic impact, like you mentioned. And so the frustrating thing is that basically all of those pandemic programs have expired, which means that we're returning to a state of food insecurity that is essentially pre-pandemic levels. And in fact, during the pandemic, because of the supports, like the SNAP emergency allotments, which allowed everybody who was on SNAP to receive the maximum benefit amount, as well as the child tax credit, we actually saw food insecurity drop dramatically during the pandemic, which is amazing. But now the SNAP emergency allotments, which expired last month, were the final kind of pandemic support to run out. And so that impact was about, we calculated at the food bank here, about $103 per person per month in lost SNAP benefits in Lancaster County specifically. So a household of four would have lost over $400 on average in Lancaster County to spend on groceries over the month. So the impact, we've been able to see that actually on a week-by-week basis. We have demand levels for people who utilize food pantries, and we've seen that they have increased by more than 10% just in the last half of March alone. So it's literally like a 1-2 week difference, and we saw an increase in demand by over 10% to food pantries. But I also want to note that loss of income, which SNAP represents, and people can use to spend on food, means that they have less money for other really, really important expenses as well. So we found in our research that about 45% of people who use food pantries have to choose between paying for rent and food, and also paying for utilities and food. And so now with less money for food, that means that they have to allocate there are other funds that were going to utilities or to rent to food. So we'll see all kinds of ripple effects from this. And not only will the impact be on the charitable food system, but it will just be on people's abilities to sustain writ large in the economy.
And I also want to comment another note based on SAC information just shared is that if we think about and look at pre-COVID and post-COVID, we as an organization like Hunger Free Lancaster used to speak about how do we serve or get food into the individuals' homes, or for those who were homeless. And now it's not necessarily the homeless population, but families who have food insecurity, you know, and individuals now, and they don't understand that even though you have a household of 4 with 2 adults working, and the way, you know, the influx of fluctuation of pricing, it's very difficult for a family of 4 to sustain, you know, anything at home, and let alone be on time on their monthly rent and put meals on the table. Or even those, you know, in the city is a great opportunity for the kiddos to have free or reduced lunch. But if you go outside of the city, you know, it's not the same access for everyone. Individuals have to pay for their breakfast depending on their income. And you look at their income, it's like, well, that's not like a huge dollar amount when we really add it up towards the year. And parents are really, really thin and being able to successfully support that need for their children outside of the city. You know, so we really have to look outside of the entire county to know that there is a huge need of access to food. But again, you know, when we have to think about what we put first before the other, what we pay first before the other, families do struggle, and especially if they're not in a budget or have never been into a budget program, do not have that services or that education, it's very difficult for family to survive.
Thanks. And you know, that number is really easy to think about too. Zach said $100 a week. He said $100 a week in SNAP benefits lost for a family of 4?
A month per person.
A month per person. Okay. So
essentially
$400, right? But so just think about that month. That means because inflation on food has gone up 17 to 19%, essentially rounded to 20, right? So that means that you didn't just lose $100 a month per person. You lost $120 in spending power. So it sort of jumps on top of itself. Mary Beth, look at, or sorry, Brad, you look like you were saying.
Yeah, Zach, there was just something within the last week or two I saw from someone from Feeding America. I don't remember who to attribute this to, but the quote was that we're transitioning from a pandemic crisis to a hunger crisis. You know, we Power Pack saw during the pandemic, you know, with families receiving child tax credit money and so many pop-up programs, our numbers declined during the pandemic. And some of that I know also was because kids weren't in school and that the pickup access wasn't all there and everything. But, you know, this year we've seen our numbers explode. We're far above where we were pre-pandemic. You know, we're doing things, you know, not just the sites that I talked about before, but we've opened up our warehouse to be a pantry pickup site. So extras that we have, people that want to come here and pick up their packs have access to the things like the Panera pickups that we do, or extras. You know, Kevin mentioned kids taking the packs home. We're very acutely aware of the weight, you know, how much a 3rd grader can carry. So we won't put in like a 64-ounce juice container because it's just too heavy. But we get those here, so families who come in here to pick up our pack can get those extra things that just augments what they're already getting from us, and just trying to get more nutrition out there into the hands of the families. But we really are seeing more families, not necessarily a spike for us, but this time of year, our trend line typically is, you know, Power Packs is set up that families can enroll for a week if they need it, for a month if they need it, you know, however long that someone needs it. And this time of year, we typically find people start dropping off the program as they get closer to the end of the school year. This year, we've remained steady and even grown as the school year has gone on. Our numbers now are higher than they were 2 or 3 months ago. So it hasn't been a spike, but it's just been steady all year long that people are saying, we need this help every week.
Yeah, I also wanted to add that children in particular are 55% more likely to be food insecure than any other age group. So it's incredibly important that we target those groups. Sandra also mentioned like breakfast and lunch access outside of Lancaster City, but also in just the whole county as well. there's an opportunity with the universal school breakfast program that's in the current governor's proposal that would be a major boon to child food security. And that could be something that we sustain from the pandemic. Is one thing that we sustain, is starting with universal school breakfast and hopefully one day universal school lunch. Those are extremely well targeted, but also universal programs that would give me hope, and that would give me hope that we could counteract this hunger crisis that's coming out of the pandemic.
Thanks, Zach. Mary Beth, I keep seeing you trying to get in here. I want to make sure you hop in.
Yeah, I would say, I completely agree with everyone. We've seen a huge spike here, especially since the pandemic. And every time these benefits go away from the parents and the students who are here, we have an increase as well. But one thing we've really seen a lot is they've needed those wraparound services. So just having a food pantry open is not enough. Just having hot meals is not enough. We've had to really expand counseling services, relationships with local services. And so we find ourselves sending them throughout the county. And so those networks are so important, that we know about you and you know about our services, so that we can send these students, because many of them, food insecurity is almost like the tip of the iceberg, the piece that we see, but what they're not having, they don't have the money for their electricity. They don't have the money for internet that they need for their classes, and their children need as well. So it's been a really interesting thing. One thing we have started here is the Compassion Fund, which allows our faculty and staff to also give to these needs. And so we're able to work with students individually, but the wraparound services have been really important in that spike.
Yeah, I mean, it's always important to remember, if someone can't pay one bill, they've already made a decision about which other bill they did pay, which means that they're already strained in other areas. Phil, there's a question here about what are some of the differences in the Alice demographics in Lancaster versus other communities. And you did touch a little bit on race. Now, just really quickly plug the racial equity profile that some of the organizations, including United Way, have put together, does help us reveal that while the median income may be one way, when you start to solve for racial demographics and geography, that's a part of it. That you still have very significant struggles, even if your median's higher. But can you talk at all about why the Alice demographics seem different here in Lancaster, and maybe what are we doing well, that if you know of anything that helps us to solve some problems?
I'm going to guess, I don't know this off the top of my head without taking a really deep dive, but it's probably the availability of employment and jobs, and the fact that there's a lot of equal opportunity in employment in Lancaster County. If you look at Lancaster County versus counties that are doing worse and look at the employment index, I suspect that there's probably not a lot of well-paying jobs that are above that $20 to $21 range that are available. And I'm sure Lancaster County has more compared to some neighboring counties. That would be my guess. And whoever submitted that question, if they want to submit it to me, I can tell them after I do a deep dive research on it, but that usually is the answer.
Yeah, and I'll also just say that when you look at economic development, one of the things that you look for is whether or not there are institutions of higher education and medical facilities in a community. Lancaster has 5 health systems, if you count our solid FQHC, which is effectively a medical system. Some FQHCs are like a urgent care. Union Community Care is a full system. And so you have 5, and then you have, it's like 13 or 14 institutions of higher education in Lancaster County. 13, yeah. So you've got those resources in spades that in ways that other places don't necessarily have. The other thing, Phil, I wanted to ask you about, because I think maybe you could probably answer this best from your policy mind, is okay. So SNAP, great question that came in there from Max Stacks about SNAP. What else is expiring? I mean, Zach said we're at the sort of tail end of SNAP, but there's still some other stuff that, probably hasn't fully kicked in its impact. Can you say just briefly, like, what else are people going to be faced with when they're seeing that I'm struggling with food or I'm struggling with rent? There's a whole other thing under the iceberg. What are some of those iceberg elements?
Sure. So SNAP is just the tip of the iceberg. There's this term that everybody keeps hearing, Medicaid unwinding, and they're probably wondering, what is that? What is Medicaid unwinding? So during the pandemic, as part of the federal health emergency, a lot of folks were qualified for Medicaid assistance through their states and through the federal pandemic. That is now going away. As of April 1st, states are now reassessing on an annual basis who is eligible for medical assistance. So there are a lot of households that are going to start to receive letters that the 60-day process has begun and they may no longer be eligible for medical assistance. So now it's going to be either off to the marketplace to find a plan, or if you're fortunate enough to find an employer that provides a health plan that you can enroll in, then there's your option. Otherwise, it's pay the penalty next year when your taxes are due. There's also the rental assistance program, the emergency rental assistance program, the second phase of that. Those funds expire at the end of next year. Those monies have been spent down quite a bit in some counties. Some of the more urban counties have spent down their funds. Once those are gone, that's it. There's no more rental assistance for those folks who are struggling to make ends meet. That's probably going to exacerbate the number of evictions we're going to see. In some cases, there are already landlords refusing to accept rental assistance funds that are creating eviction problems, especially in urban areas. So this is just the tip of the iceberg with SNAP. There are a whole lot of programs that were created under the Affordable Care, under the, sorry, I have all my acts stuck in my head because I am a policy person, under the CARES Act, under the Consolidated Budget Act, under the American Rescue Plan, that were meant as these temporary fixtures to help people. But the problem is, we hear this term fiscal cliff. Well, now we've got the pandemic cliff. All of these programs are going away and there's no smoothing process. Eventually, people are going to hit a wall where all that help they had, it's gone. And we're back to where we were at pre-pandemic level in terms of income, but now everything's more expensive and there's no support. And where do we go? My advice, or a couple pieces of advice I can give you, is call 211. If you're not sure where to go call 211. It's available 24/7, 365, and there's someone out there that can provide you with assistance. The other thing is reach out to your legislators. We're fortunate that the governor has proposed putting state dollars in to cover some of the losses of federal pandemic assistance funds. The hope is that the General Assembly will vote to do that and stave off some of the major economic impact this year into next fiscal year. Either way, we're still going to see a major impact, and we're all sitting on the deck of the Titanic as that iceberg is coming, and there's a lot of federal pandemic assistance that's set to expire at the end of this year.
Yeah, so, thanks for that, Phil. And I just want to mention real quick, did you have
somebody just put this in the chat, and I'm glad they said that.
Yeah, please.
And then those who are disenrolled from MA, have the opportunity to be enrolled in Penny, the state's marketplace system.
Yeah, and so there's an email there from Judy Wechter, who's recently taken on some increased responsibilities in that role, and we're really grateful, Judy, for you being here. Please reach out to Judy if you need assistance around the Penny and the healthcare enrollment. The other thing I want to just mention, when you talked about government and advocacy, we often talk about taxes, right? Especially for seniors, for taxes going up and the impact there. But also watch, one of the challenges for sort of the third-class cities, which most of these sort of areas in Pennsylvania are, right, is that they can't, there's a limit on how they can charge to raise tax revenue and sort of property tax. And then there's limits to how much they can raise that. But where there's not limits is water bills, sewer and trash. And so you start to see all these fees go up significantly, right? Fees, like it's not a tax, but these fees go up significantly. And so that's the other thing that's really going to hit people. And, particularly one of the concerns is that people don't always know. If you have your water shut off, your house is automatically condemned. So when you're playing that shuffle game of what bill do I pay and what bill don't I, you're like, you know what? I'm just not going to pay my water bill. I'm going to go to the bathroom at work and I'm going to buy bottled water and we'll just have to deal with it that way. I'll take a shower at the gym and you don't pay your water bill and all of a sudden your house is, or your apartment or whatever is condemned. So just, these are the types of things I don't know that our community is always terribly well aware of. But then continuing on sort of some possible avenues for solutions. I'm a huge advocate of 211. I love 211, but 211 is a portal into other services. 211 doesn't provide the service. So we've got to make sure that we continue to fund our nonprofit partners through charitable contributions and through advocacy, through grants and foundations and government, because if the organizations are in the database, but they don't have the resources to have a service, 211 is just pointing someone to a dead end, right? So we've got to think about that whole pathway through. Zach, the question here, Mac had this follow-up question, and I'd love for you to answer it because I know that we're heading into some strategic planning for Hunger Free. Can you talk about what United Way, Central Pennsylvania Food Bank, the Hunger Free Lancaster, which includes both Sandra and Brad and 30 some other organizations. Can you talk about what this food mapping project is going to lead us into to focus on addressing food insecurity?
Yeah, absolutely. So the food mapping project will hopefully have two different tracks that Hunger Free Lancaster County can address in its strategic planning over the coming months. The first being, what can we as a charitable food system do to ensure that access to charitable food when people need it is always there and always available and is easily accessible to everyone. The second is, what can we do to address some of those underlying issues, and what is the role of Hunger Free Lancaster in that? So the hunger mapping project is, and the data we've been collecting is showing just the intricate ties between food access and the other issues that we've been discussing here. So we're going to be examining, okay, what is our role as a charitable food system, as Hunger Free Lancaster County, in addressing some of these root cause issues, in addition to our core food banking work and making sure that no one goes hungry, even if they've run out of funds for other things as well. So that's the core of it. There's lots of other things Hunger Free Lancaster County does to coordinate and address a variety of issues. Some of it includes advocacy, and some of the things that we'll be finding in this report will be directly related to advocacy and systemic level changes that we can promote to further address root causes. There's only so much that we can do as a local community. We have to work to promote policy change at our local level, but also at the state and federal level.
Thanks. Sandra.
And Kevin, I'll just jump in real quick if you don't mind.
Brian.
So there was a similar mapping project done in York County a year or two ago. And as you know, as PowerPax has school districts reaching out to us asking for partnership, we used that map to help us determine where we could go to meet the need. So for instance, I mentioned that we moved into Eastern New York School District. On that mapping project, we could see there was a high level of food insecurity in that school district, but a low level of food distribution. So we could really make more of an impact by choosing that school district than some others. So I think that's some of the information that will help organizations like us and other food pantries determine where we can make the greatest impact. And that's why it's so critical for us.
So we've all got limited resources. Where do we deploy them in the most effective way?
Exactly.
This goes to 11:30, but I know being 10:57, some people are probably going to drop off in a minute here. Just a reminder that you will get an email with the full recording. So if you do need to leave, you'll be able to watch the rest of this conversation. Just wanted to state that, but thank you if anybody does need to leave for your participation so far. So Sandra, jumping back over here to you then about the sort of Brad mentioned earlier that the senior food boxes are now sort of able to be delivered. Can you talk about that change or any other changes that have been able to increase your ability to deploy resources to the individuals who need them?
Absolutely. So part of our program, thanks to the partnership also with the Office of the Aging of Lancaster County, is that we also have the food boxes particularly for senior citizens and those who are food insecure, who are not necessarily seniors yet. And we're able to have them delivered to SACA and being able to disperse them among those who are registered for this program. Again, thanks to also the Central Pennsylvania Food Bank. But the other great opportunity that we have for those seniors who are enrolled in our program is that we're able to pre-packed homemade food and be able to send our seniors home over the weekend with breakfast, lunch, and dinner. So we know that not all seniors have the capacity to actually prepare a meal at home, or who are living with children who may not be working and cannot necessarily prepare those meals for our seniors. And we have the opportunity that our seniors can also take advantage of being able that every Friday, they're able to take these meals that are preparing in our kitchen, and that they're able to have those 3 nutritional meal on the weekend. So that's another opportunity that we do have beyond the boxes. We do have food Fresh Express also through the Central Pennsylvania Food Bank, which is very important. One of the things I wanted to comment earlier in some of the conversation is that we're able to refer our clientele to the food hubs and the pantries. But again, how many of them actually know how to utilize some of the food items and that they're receiving within there? Talk about Latinos particularly, you can see a can of beans, but that can of bean may not be prepared the same way as we will prepare it, because we know what kind of beans we prepare and we we are accustomed to, or a particular vegetable. Somebody may look at squash and squash is prepared a certain way. To us, it's like a pumpkin, a pumpkin or a potato, and it's not prepared the same way. So depending on all these foods that we're actually providing our clientele, we also have to be mindful of, okay, the recipe, back to Brad, is a great opportunity to say, okay, here's all these items, but this is how you can use it, how you can prepare it and be healthy for you and your family. But when someone is walking into a pantry or going to a location and receiving a box of food, that we also have to kind of provide that guidance of, okay, here's just how you can use all these items within your box, or here's a place that you can go online if you have access to internet, again, to be able to search, how do I use this product and that product. So these are all things that are common among anyone that we're serving in our community, and ensuring that particular senior citizens are receiving this nutritional meal, all the ways down to our children, and ensuring that they're having a nutritional value meal on a daily basis, at least once. But of course, the goal is to at least have 3 to 5 a day.
And I want to jump right on what you just said, Sandra. Brad, you said this before too. I know, being part of Hunger Free Lancaster, this is a big push that we've been trying to shift. I know I've been pushing it as well. Food, I always have an issue with the phrase food insecurity or food access. It's not just about food. I can give you potato chips and pizza every single day and you're not hungry, but you're not being treated with nutritious food. We've got to continue this focus, and you hear it. It's embedded now in the language here in the network in Lancaster County, that we're talking about providing nutritious meals, nutrition. We're not just trying to make sure that you don't go starving, which unfortunately is how our system has largely been made, right? Oh, I got this dented can, I'm not going to eat that. Oh, I've got this expired box of food. Let me put all this stuff I would never eat and never put in my own body in a box, take it down to the food pantry, and those people who are hungry will be glad to receive it, right? That is not the way that we need to be addressing our communities, particularly when we talk about those kids. Nutrition is brain power. Nutrition is brain development. If we're not helping make sure that kids, even if they're not our kids, I shouldn't have to support them, they're not my kids. Fine. In 20, 30 years, when you have a higher iteration of crime in your community because your kids were not able to succeed in academic pursuits and to advance their own station in life, you are culpable for that. Personal responsibility is wrapped in communal responsibility. And so it's really important for us to continue to think about nutrition and how we're helping one another. Even if you want to look at it self-interest, which I hope you don't, but even if you want to be self-interested about it, it's still in your best interest to be getting out there and supporting the nutritional development of children and the continual development of food access for the rest of the community.
Yeah, Kevin, if you look at our mission statement, a big part of it is to empower families to make better, healthier food choices. It's not just about providing food, it's about providing the right kinds of food, and then also to try to maybe introduce kids to new foods. Whether that's carrots or something else, we really want to provide them with the nutrition they need to be able to grow and develop and thrive in school.
What I was going to say, as part of our Hunger Free Task Force here at Millersville, we have our chef and a nutritionist on that task force. And so one of the things that they are doing is working with our pantry on campus and working with our students to teach them how to use what is in the pantry and what is important. So they're having cooking classes as part of the grant that we received from in partnership with the hub. So having those cooking classes has been really important and led by somebody who knows food, so that they know how to take things from the pantry, use them in a nutritional way that is sustainable for them, in ways that they can make large batches and think about things like that. So I think having a chef on that task force and then having cooking classes as part of the grant has really helped our community a great deal. And we're seeing, today's college students and really to all of today's adults are looking at nutritional value because it's not just empty calories. They want food that will last, food that will be good for them, and they have more food allergies than ever before as well. So learning how to work with that has been complicated, but I think is very important.
That class is amazing. one thing I've always been frustrated with, as SNAP has said, more fresh produce, like, which is great, super supportive of that. Less prepared foods, great, super supportive of that. But someone doesn't have a pot or a pan, and you can't buy that with SNAP. So you have to think of the whole process. How are we making sure that people are educated and also have access to the tools to accomplish that task?
Hey, Kevin, we just even just
ahead.
a month ago worked with the Junior League here in Lancaster, and they collected can openers for us, because you assume everyone has a can opener. And if we're giving canned goods and someone doesn't have a can opener, it doesn't do a world of good for them. So they collected about 1,500 can openers for us. We stuck right in our packs, and we know now that everybody that's getting a canned good from us at least can open it. Just those little things like that. It's a great way to think out of the box, so to speak, and think about what you take for granted sometimes.
Yeah, that's great. I mean, early in the pandemic, you might have still been with us at United Way, Brad, when we had brought together 9 organizations to put together food boxes for community members. And Mennonite Disaster Service, Mennonite Central Committee had given us the canned meat that they usually send internationally, and we were like putting it in. We were like, people can't open this. So the can opener thing had popped up there too. It's so simple and reasonably cheap, and yet you don't think about that when you're so focused on food. You don't think about that delivery system there. There's a question here, which is a general question to panelists. How do various agencies address hunger issues in Lancaster County and collaborate so that various services complement and fill the gaps? Just real briefly, again, that Hunger Free Lancaster Coalition is a coalition of, I don't remember the exact number, I think it's 38 of us different organizations. We do meet regularly. We share ideas. Sandra was talking about the cultural element and tying that to Brad's recipes. We had a racial equity group that I had been chairing for a while. And one of the great conversations that happened was around this particular topic. And Church World Service came and said, we have some recipes for some of our refugee families that help them understand the context of how to use some of this food. And so, Sasako's doing it, Brightside doing some classes and all these things. So we do meet regularly, and we're right now waiting for this food, sort of the hunger mapping that we're doing to help us, as Brad talked about earlier, prioritize the where, because we have limited resources amongst all these different organizations. How do we prioritize the where?
Yeah,
Kevin,
absolutely.
I can give a couple of specific examples about that collaboration. So, for instance, about a year ago, up in Lebanon, there's a big distribution plant, and we received 3 donations from Nellie's Eggs. This is before the avian flu and before the cost of eggs went through the roof. But we received 3 donations of 10,000 eggs each from Nellie's Eggs. Way more than we could ever deal with, because I'm not putting eggs in the hands of kids walking home from school for a variety of reasons. So, we started reaching out to partners here. Who can we share eggs with? And Salvation Army took some. Lebanon County Christian Ministries up in Lebanon took some. The Food Hub took some. So, we're always looking for, if we have something that's extra like that, we'll share it with whoever can use it to get it in the hands of the people. So, we're starting a small partnerships now, and just one more example, with an Edible Classroom. If anyone knows that nonprofit here in Lancaster City, they're doing gardening in schools, and our missions so closely align. So we're starting to work with them a little bit also with getting some of the product into Power Packs and into the families that we're serving. So just a couple of specific ways that we're collaborating with other nonprofits.
Yeah, the collaboration also extends into this research that we're doing. So we've conducted surveys among food pantry users and visitors who visit 11 different partners across Lancaster County. So we chose geographically diverse pantries to do surveys at, collected 740 survey results, and are working with Hunger Free Lancaster County to apply the learnings from those results to improve services. Also mentioned that we've already identified through our interim report areas across the county that may be in need of additional supports. So we identified like Southern Lancaster County in particular as being an area with very few food options, as well as Northwestern Lancaster County. And there's not a ton of of options across the border into Lebanon County or even into southern Dauphin County as well. So those are two areas that we've identified just geographically. But looking at, we've been collaborating with organizations to look at, okay, where do people actually visit so that we can estimate our gaps and where to target based on where actual people are coming from, and not just based off of where pounds of foods are going, but really focusing the neighbors in our decision making. So that's how we've been collaborating across this report and into the future.
And it should mention also like Whittle Foods Farms. So there's some growers and some other produce sort of generating entities in Lancaster that are able to be part of the Hunger Free Lancaster Coalition that then helps us to route foods. I mean, we're one of the breadbaskets of the world. Like, we shouldn't have to rely on USDA trucks coming from elsewhere, right? I mean, that's obviously great, but that should be supplemental in times that we don't already have the resources here in Lancaster. We answered this question that Mac has in the chat, but in case anybody didn't see it, the final report for the mapping project is going to be in June or July. I know that Tim here for One United Lancaster will be putting out some information on that. So if you follow that regularly, you'll see it there. But we'll also be trying to get that distributed widely across news media, and we'll see what other events or activities we have to roll that out. Maybe even one of these future community conversations that might be a good presentation topic, but just so that we verbalize that for those folks who catch the recording later, the mapping that we keep talking about in June or July, you'll see that.
Yeah, we may do the official like press release in August, but June and July is when we're finalizing.
Yeah. So maybe this is a question for you, Zach, sort of directly, but maybe some of the others of you, because you exist in this world. The question is, during the pandemic, Joe Arthur was talking about infrastructure upgrades in the food charity system that the food bank was supporting, such as more robust cold chain, better storage capacity at local food pantries. Have those been made, and have they helped? I'll let you go at this, Zach, but I'll also say that there was also from the state significant millions of dollars that were put out in some grant monies around infrastructure as well, that I know some different organizations were able to buy coolers and vans and other things with. But Zach, I don't know the specifics if you have that on a broad.
Yeah, absolutely. So we've made significant investments and improvements in all of those things in the capacity of our partner organizations across Lancaster County. But I also want to mention there's a lot of work yet to be done. In particular, in our mapping projects, we've found inequalities across race and place. So for instance, one thing I haven't mentioned yet is that food insecurity rates among the Black and Hispanic population in Lancaster County is 21%. Compared to just 6% among white individuals across Lancaster County. And as that relates to pantry access, we found that client choice pantries are more likely to exist in areas that are heavily white, and pre-pack pantries are more likely to exist in kind of the majority or plurality Hispanic areas of Lancaster City. So there's also that has also something to do with the capacity of some of the pantries and the food storage opportunities that they have. So over the coming years, we'll be working to address some of those inequities, but there's already been a lot of progress to make, but there's already been a lot of progress that has been made, but we still have some way to go.
Thanks. And, I know I looked at sort of who all's in this conversation, and there's some great individuals in the attendee side of this webinar who are doing great work. And one that I see in there is Paige McFarling, and I'm thinking about the Food Hub. And there's so much right now around the sort of the housing issue and the homelessness issue and those things that are pressing the food banks in the city to address some of those concerns, probably outside of the city as well. I'm curious, what are some of the crossover populations that you're maybe seeing? And maybe Mary Beth, you have some thoughts on this in the fact that you're in an institution that has non-traditional individuals coming there, but where are some of the pressures that you're seeing outside of like what our mission's supposed to be about versus what the challenges of our community and our society today are feeling?
Yeah, I think you're absolutely right. I mean, we say that we're an educational institution, and yet we cannot expect our students to learn if they don't have a place to eat, a way to eat, a place to live, and all of these things. And so I think the true crossover is we are a piece of everybody in Lancaster County, all of the ages, the different demographics. Many of our students ride the Route 16 bus from Lancaster, from downtown Lancaster out to Millersville. And so I think one of the pieces we talk about in our Hunger Free Task Force often is the problem with food insecurity is two things: communication and collaboration. Often our students don't know what they don't know, and they don't know who to ask, and how can we really encourage that communication through not only us telling them about agencies, but giving them the power to find these agencies as well. And then collaboration between them. In a county like Lancaster that has so much food wealth, it seems like we should be able to collaborate and make this. So a lot of our students really are dealing specifically with housing right now, and housing is the biggest second kind of pressure point, and many of them do have children, so trying to find ways to feed and house their children as well as so it is a across the board issue for sure.
Yeah, I mean, I wrote down the numbers that Phil presented earlier on the survival budget for housing costs. I mean, it's not even within 50% of anything close to a reality, if you can even get it, right? Like, that's the cost if it's available, and it's not available. Yeah, Phil.
Remember that calculation's 40% of the HUD fair market value.
Right. Those
So-
numbers don't exist. Those numbers don't exist. Unless
Not
you
only
have
do they not exist, but even if you find it, it's probably going to be 5 times what that number is.
it's yeah. I mean, unless you have a friend or a family or someone else who's able to rent you something at that level, that rent is not a real, it's just not a real number. So Rakesh has a great question here, and it moves us, we're at 11:17 anyway, it moves us into what I mentioned before we started, which is sort of this wrap up section. So, his wording is great here. So what will be one thing that you wish you could do in your organization to increase your respective impact? And then I'll tie in that little question I had sort of keyed you up on, which is invite people into the work. What can people do? I'm the United Way President CEO. You all can make financial contributions to every single organization that is here, and involve yourself in a variety of volunteer ways. We'll have Week of Caring coming up. Hopefully, by the way, we'll see you tonight at our One United Lancaster event, so you can be informed. So for us at United Way, right, it's continuing to provide financial support, continue to be made aware through the different avenues that we're trying to put out on helping the community be educated and aware. And I'll just let y'all hop in popcorn. Whoever gets in first goes.
I will definitely, I mean, beyond what Kevin just mentioned, volunteerism is huge. One do not know how much that volunteer time frame that we provide across the entire county can make a huge impact to the families we serve across the board. Kind of what I mentioned in the beginning, and Mary Beth kind of reiterated, the wraparound services as well. It's not only providing a service, but making sure that the community is aware of what services are out there. I would give a great example. SACA has the opportunity to provide their microphones on the radio to be able to reach not only the Lancaster County, but also reach the York County, and being able to reach those families who otherwise will not know about these agencies, organizations exist, and how they can access these organizations. And now we are actually even streaming. So through any platform that you go on to stream any of your programs, this information can also be passed on beyond just locally. So the important thing is, again, collaborate, communicate, kind of Mary Beth mentioned earlier, but SACA has the opportunity to open their doors for anyone who want to come in and volunteer through our community meals program. We encourage different faith-based organizations to come on board to be part of our community meals program, and have a firm information table there, and just network and mingle or talk to the individuals who are coming, attendees to our community meals program. That provides an opportunity for them to be comfortable enough to express their needs beyond our organization, and be able to say, okay, I trust this person, I'm willing to open up to discuss my needs, and I know that they're gonna come back and provide me that information that I need, or that resource. So, for us, I would say definitely, reach out to myself or go on our website, and there's definitely plenty of opportunity for volunteerism and networking within our organization.
I'll jump in and just say, my biggest wish really is that we weren't needed. However, we know that's not going to happen anytime soon. So my second biggest wish is that we could really just serve everyone who's asking us to help them. I mentioned earlier, we moved into Eastern York School District. We've had other school districts in York County. We've had Berks County. We had a school district in Western Cumberland County reach out to us. I'd love to be able to say yes to everyone. However, as Kevin has said, we have limited resources. We have a budget, and our budget has been stretched much farther this year than my board likes. We're running at a deficit. I'm not ashamed to say that, because we're serving more people and our costs are higher for everything that we're doing. But we'll keep doing as much as we possibly can to help the people out there. That is my wish, that not one child goes hungry in our area. Not one. Not one child will miss a meal, will skip a meal because they have to. We're just trying to change families' meal patterns and make a difference in a child's life, one meal at a time. That's what it is, one meal at a time. And how can someone help? Come to our website and sign up to volunteer. We can always use more volunteers. The dedication of the volunteers we have is just tremendous. They're right across the wall from me. You might have even heard them today. They're out there packing and having a great time. And we're grilling for them as soon as we're done here at 11:30 to recognize all they do to help us. Or make a financial contribution or collect food for us. Any of those things will help us be sustainable and put food in the hands of kids and their families who need it every week. And that's all we can all ask.
I'll follow up with that and just say, to to quote Dr. King, everybody can be great because everybody can serve. There is a way to serve in our community. For me, food is my love language. And so feeding people matters. And if you look, there is a way to feed people. All you have to do is look at one agency and find a place, whether it is your time or your talent or your treasure, but find a place to give, because there is such incredible need. And for me, I just love food. So talking about it, feeding people, and I think that's true for a lot of us. And so finding that place and just asking the question and being available, because everyone needs to eat and everybody wants to feel valued. And this is a really great way to make other people feel valued. So whether it's at Millersville or any of these great agencies, there's a time and a place that people need food.
Yeah, and I'll jump in that one thing I hope our organization continues to do is act as that convener and collaborator across organizations. So continuing to support Hunger-Free Lancaster County and also increasing collaboration. So we found in our research that pantries often refer folks to the Lancaster County Food Hub, but there's and needs to be an awareness of other organizations as well. The Food Hub does a fantastic job of serving the entire county. So I think that's why there's a reference, but that also means that there's tons of opportunity for increased collaboration. And I hope that our data and our research can continue to foster that collaboration and help us to all collectively work together in the most effective manner. Things that you can do. I wanted to elevate something that Loina said in the chat. Loina's from the food bank as well. But when you volunteer, we found it in our research, it's incredibly important how volunteers treat people. Experiences can be good or bad depending on the treatment that people receive based on volunteers. So it's not, I would absolutely encourage folks to go volunteer, but it's not just enough to be there. It's bringing that empathy and that respect to every single interaction that you have, because one bad interaction could mean that somebody would be less willing to go seek food in the future. So that's really important to remember. Also, donating is always important. We have limited resources as a coalition and as an organization. And then ultimately, and this will be a good transition to Phil, I think advocating for policy changes at the systemic level is how we can one day hopefully end food insecurity once and for all.
Thanks, Zach, but I want to step back to something you said about respect, and honestly, dignity is something that's really important. So we use the term asset limited, income constrained employed, because no one should be singled out. People are working and trying very hard to make ends meet. Everybody's been there at some point. I grew up that way. My parents both worked jobs, struggled to make ends meet, helped us find our way through college, and we still walked away with college debt. I have children. Everybody out there has a family. Everybody knows somebody who's struggling. Love thy neighbor, the most important lesson you can ever learn. On the advocacy side of things, there are people who just don't want to believe everything that's out there. I put links to both our website and our advocacy page. When you have a chance, if you're interested, please take a look at our platform. It's really simple. We have the data and the numbers. We use them every day to talk to our decision makers about why it's important to support programs and why it's important to support policy ideas that really do help average households here in Pennsylvania. We're not asking for billions of dollars in state funding for anything extravagant. We're asking to help people make ends meet, plain and simple. We're asking for things like a state earned income tax credit to give working families a couple dollars back in their pocket. We're asking for the General Assembly to take a look at what childcare workers are making, which is around $12 an hour. Childcare is one of the most essential services that any working household could possibly get. When the folks who are working in the sector are also Alice, they need to make decisions for their family as well. And in most cases, that means leaving the sector for a better paying job, which could be found at Target or Walmart. These people at one time were called essential workers during the pandemic. We need to treat them like they're essential. Everybody in our economy is essential to it, no matter what role they play. We have the data to show that. We have the programs that are out there. We need to adequately fund them and help people get to where they need so that we're all in this together at the end of the day.
Thank you. I put in the chat here the United Way, and you can go to our website as well, but the volunteer portal, I know that Power Packs, I know that SACA have listings there, and others do, probably Central Pennsylvania Food Bank and others who are partners on this call who are not part of the panel. So please go ahead and see if there's a way that you can give, you can volunteer, you can advocate. That's 3 of our sort of touchstones there at United Way. I appreciate each and every one of you panel. Oh, one more thing on volunteering. Volunteering should not be on your prerogative. Volunteering is on the prerogative of those who have been disenfranchised either by the choice of people who have removed their ability to participate or the circumstances people find themselves in. And so that dignity part is really important. When you show up to volunteer, it's not for you, it's for others. And so thank you all for the ways in which you are helping to advance this community. Our panelists, thank you all. This was a great conversation. High participation from you who have been asking questions. Thank you so much. The recording will be made available as soon as we can. We'll send out that follow-up email as well. And just again, thank you so much for all of the parts in which you care for your neighbors and those, whether they're strangers, friends, or even enemies. We are all Lancastrians, whether we are born here or whether we're living here for a time. And it's important that we look at one another with dignity as we see each other's whole self, no matter what circumstances they're in. Thank you, everybody, and take care.